have Dr. Rajneesh Kumar, Dr. Vikram Deshmukh, sir? Yes, sir. Okay. So we'll go with our next session, that is on medical legal issues in homeopathy. And it is again one of the most important. We need to speak about the other pathies, allopathy, homeopathy, Ayurvedic. And so we have with us to chair the session, Dr. Vikram Deshmukh. And Dr. Vikram Deshmukh, sir, is a neurosurgeon, and he is based in Amravati. He's the director of Shri Urology Hospital, Amravati, which is an NABH accredited hospital. He has been a joint secretary of IMA Maharashtra State 2021. Welcome you, sir. And I would introduce our next chairperson, Dr. Rahul Kolamkar, sir. And he is a homeopathic consultant, and he is a director of Elite Healers Homeopathy and Research Institute. We welcome both the distinguished chairperson to the session, and please carry on with your session, sir. Thank you so much.
Thank you, Imlea. Thank you very much for giving me this opportunity to express my views on legal issues in homeopathy.
Chairperson for
please introduce the speaker persons.
Yeah, good afternoon, everybody. This is Dr. Rahul. Today we are having a very renowned speaker, Dr. Rajneesh Kumar Sir from Uttarakhand. He's a consultant homeopathic physician, as well as he's a vice president for International Homeopathy World Community. He's a life member of Homeopathic Medical Association of India also. He's practicing since long with and having his own institute named with Homeocare at Kashipur, Uttarakhand. He has been author of several research papers, articles, case presentation, and books. Recipient of many international awards and national awards. He is the chief managing director at Homeocare and Research Institute, Vaibhav Homeopathic Pharma and Sports Multi-Speciality Hospital. So we are delighted to hear Mr. Dr. Rajneesh Kumar, sir. Over to you, please.
Thank you, Imlea, for giving me this opportunity to express and share my views on legal issues in homeopathy. Let me share my slides. Yeah. Yeah. Homeopathy is the second largest system of healing art accepted worldwide. But alas, it is being ignored frequently by government as well as government officials and general public. Government has given certain rights and exemption to homeopaths also. For example, homeopaths can use all the necessary measures in treating a critical care patient. They are exempted from biomedical waste treatment. They are taught each and every subject except allopathic pharmacology in their syllabus, but their studies are not accepted at times. For example, anatomy, pathology, physiology, biochemistry, radiology, forensic, surgery, gynae, obs, community medicine. They are not supposed to be at par with our other system of medicine. For example, I can quote a notice served to me by Pollution Control Board last days. I have asked for the biomedical waste produced within last 1 year, and to serve the report within 2 or 3 days. You can see the GO from the same Uttarakhand Pollution Control Board. The homeopaths are exempted from biomedical treatment facility if they are non-bedded clinics. There are some rulings from Central Council of Homeopathy. Duties of homeopathic practitioner to the patients. Patients should not be neglected. All right, it must be, and homeopath is free to choose whom to be to whom to treat, provided he shall respond to any request for his assistance in an emergency or in public interest. And a practitioner of homeopathy shall use any drug prepared according to homeopathic principles, all right, and adopt other necessary measures as required. This point should be noted. The homeopathic practitioner will use homeopathy medicines only, okay, but he can adopt other necessary measures as required. Other necessary measures, these may be correction and maintenance of airways, breathing, circulation, fluid and electrolyte balance, BP maintenance by IV fluids, homeopathy remedies, oxygen, blood transfusion, nutrient supplementation, minor surgeries like stoppage of bleeder in case of emergency, fixation of fracture in case of emergency, and conduction of normal labor and maintaining the complicated patient of labor prior to refer to the concerned specialist. He must do the first aids to all the critical care patients, CPR, defibrillation, shock management, ventilator use. These are necessary measures other than medicine. But there are certain rumble strips in these ways to be adopted by homeopathy. Actually, homeopathy is not restricted to sweet pills only. The public thinks the homeopathy is the sweet pill and there is nothing more than that. But homeopathy is far away from these. Most of the government officials or even general public think that the use of IV fluids, supplements, blood transfusion, etc. is not the part of homeopathy. Rial tube, Foley catheter, ventilators, lavas, these are not related to homeopathy. FNAC, biopsy, minor surgical procedure are not related to homeopathy. The tests like ECG, TMT, EEG, echo, pathological test, radiological investigation, these are not supposed to be included in homeopathy. I'm showing there are certain limitations of homeopaths, like with query. There is no right to do logical or pathological investigations. In an RTI, the answer is uncertain. The Central Council for Homeopathy says no record found available in this council. Again, rumble strip. Government issues the certificate as trained COVID-19 patient, trained COVID-19 practitioner to the homeopaths. But local authorities raise questions if a homeopath could treat a COVID victim. This is the certificate. There are certain rights. Homeopaths have right to participate in public health and epidemic. This is the ruling number 36 from Central Council of Homeopathy rules. Practitioners of homeopathy engaged in public health work shall enlighten the public concerning quarantine regulations and measures for the prevention of epidemic and communicable disease. I am cutting short. When an epidemic prevails, the practitioner of homeopathy shall continue his labors without regard to risk of his own health. Right? This is a clear indication of. Again, homeopaths have right to give any evidence in court required by law. This is the ruling I have in RTI also. The homeopath shall be entitled to give any evidence at any inquest or court of law as an expert under Section 45 of Indian Evidence Act, 1872. Another, homeopaths have right to issue any certificate required by law. He shall be entitled to sign or authenticate a medical or fitness certificate. Whenever a registered medical practitioner is asked, homeopaths have right to use supplementation and routine diagnostic methods. This is the answer by CCH, Central Council for Homeopathy. He can use the necessary measures other than medicine. There is right to conduct normal deliveries. This is the answer from RTI. The practitioner of homeopathy, he can do. There is right to write prescription, prepare and dispense the medicines. In somewhere I was listening, the writing of the prescription is only the right of the MBBS doctors only, but a registered medical practitioner can prescribe, dispense and write the remedies. This is the ruling number 37 from Central Council of Homeopathy Act. A practitioner of homeopathy has a right to prepare and dispense his own prescription. This is the Gazette of India. Full insurance coverage is there. आयुष कवरेज, बीमा कारों द्वारा गैर एलोपैथिक उपचारों का भी कवरेज दिया जा सकता है. बशर्ते कि वह उपचार किसी सरकारी अस्पताल में हो या किसी सरकारी मान्यता प्राप्त या भारतीय क्वालिटी परिषद या अन्य उपयुक्त संस्थानों द्वारा मान्यता प्राप्त हो. होम्योपैथी इज देयर. There are some bonds for homeopath also. He must practice homeopathy only. Okay. He must disobey the rules of homeopathy. Okay. And he must follow each and every rule, like Drug and Cosmetic Act, Pharmacy Act, Narcotic Act, Psychotropic Substance Act, MTP Act, Transplantation of Human Organ Act, Person with Disability Act, and Biomedical Waste Management Rule. All the rules and regulations are common for Ayush and other than Ayush system of medicines. The duration of study and syllabi are same in various medical streams, except one subject, that is pharmacology. In allopathy, in MBBS, we learn allopathic pharmacology. In homeopathy, homeopathic pharmacology. In Ayurveda, Ayurvedic pharmacology and Unani, and so on. There is no difference in all the other subjects regarding basic subject, anatomy, physiology. I've already told all the subjects except pharmacology. There is no difference. In interpreting and reading various scans like MRI, CT, PET, X-rays, ultrasound, echoes, TMT, pathology, or many other diagnostic modalities, what is the role of pharmacology? I wonder, why are such restrictions to our system of medicine in utilizing many of them? PCP, NDT, AER, we have different moods with Ayush wing. Why is registered medical practitioners definition is being restricted to the schedule of MCI Act only? The qualified doctors registered under other councils like Central Council of Homeopathy and Medical, Indian Medical System Council, Ayurvedic Council, etc. They are also registered medical practitioners. They can prescribe their remedies, they can write the prescription, but with their respective pharmacology only. Why is there uniformity? There must be an uniformity in all the system and rights of the doctors. Why is there uniformity in all the syllabi and duration of study? Why? The rules for them should be uniform. Thank you very much. Thank you, Imlea. And a special thank to Dr. Anurag sir, the General Secretary, Imlea.
Thank you, Rajneesh sir. This was really a very precise and a very point-wise collection of all the RTI rules and regulations regarding homeopathic practitioner for doing a homeopathic practice. It was really good to learn a lot of points. It has enlightened me also, having so many points to ponder. There can be what we can say. There can be common points where doctors can come and elaborate those rules and regulations to a newer level, so that the medical system, which is under pressure for all the points, it should be with us. It should strengthen the health industry of India. So with that, I would like to thank you for your points and.
My pleasure.
I thank distinguished chairperson for excellently chairing the session, and I congratulate Dr. Rajneesh for such a lucid talk on the homeopathic point of view. Definitely, each and every thing of branch of medicine, field of medicine has got its own importance in the way, and the ideologies might be different. Ultimately, the aim is to treat the patient rightly and correctly in all the ethical manners as possible. And there's a long way to go, but yes, the message of the day comes is that doctors should refrain from any sort of cross-pathy or cross-specialty in their branches or respective fields. Thank you so much, sir. And we again continue